Why do we have health care? Because when we get sick or hurt, we want to be taken care of and we want to get well. And health care affords us emergency treatments and scans and x rays, lab work, medical procedures, surgeries, hospital care. The list goes on.
Right. There's everything that you might need if you get sick. And of course, that's what the system depends on, is you're getting sick.
Well, did you know? Well, we already know that healthcare is a business, but did you know that healthcare in the United States is a $2.8 trillion industry and it depends on sickness? So where does prevention fit in? Is healthcare just about making money?
Well, it's not just about it, but that's primarily what the people who are in charge of healthcare today are oriented to. The hospitals, the medical industry, the pharmaceutical companies. It's about return on investment. So it's not so much about service, although obviously there's a lot of high-tech service. It's all over the place. You spend $2.8 trillion a year, you got to get something back in terms of service. But when you're looking at overall quality of care, according to the World Health Organization, Vicki, we're ranked 37th in the world. We're behind third world countries in some situations. And why is that? Because it doesn't mean throwing dollars at health care is going to give you better health care. It just means you're going to spend more money and it's going to keep the economy going.
Well, so then is prevention a conflict of interest in our healthcare system?
Absolutely. It would be. And look at doctors who are not trained in wellness and prevention and lifestyle measures to any significant degree.
Well, doctors are trained a lot by pharmaceutical companies.
Yeah, but they're not trained about wellness.
That's what I mean. They're taught about using drugs.
They may be talking about somebody who's got a high cholesterol and say, yep, you should be on a good diet and you should lose weight and exercise. But for now, let's use that drug, okay, that statin drug that's going to lower our risk for having complications of a high cholesterol. So there's nothing like going to a doctor that's overweight and smoking, that doesn't exercise, that doesn't look that healthy. And that's a sign, a telltale sign, that many doctors aren't oriented that way. In fact, we don't have much in the way of reimbursement from insurance companies for wellness. It's only a little part of what Obamacare is offering, and I don't think Obamacare is great, but one of the good things about it is it does offer a little bit for wellness and prevention.
Well, you know, unhealthy products are big business, and many of them are unhealthy. Things like cigarettes and, you know, alcohol and drugs and
Yep.
and GMOs and fragrances and skincare products and sunscreens.
Well, it's about making money again. It's about profit. It's return on investment. And if you've got a product in this culture, this American culture, or in the modern world, then you've got something that is going to be sought after by a lot of people because they want the money that comes with it and the power that comes with it.
Well, another one that I wanted to mention too was about aspartame, because what's interesting about aspartame, the artificial sweetener, also referred to as Equal, and what's the other name?
There's a bunch of names.
NutraSweet, and
Equal
Spoonful.
Measure, and Spoonful. Those
Yeah.
are all aspartame.
All those, but the thing about it is that a lot of the things that the aspartame can create as side effects are things that, like a diabetic, for example, who might want to reach for an artificial sweetener,
Right.
what they're trying to avoid is what the aspartame can create. Like, it can create weight gain, it can create diabetes and metabolic syndrome and
Exactly. And heart attacks
increase
and strokes.
your appetite and heart attacks and strokes, which we're very concerned about.
Well,
with
see, that was
diabetics.
your study, okay? The Women's Health Initiative at Harvard that you've been enrolled in for, what, 30
Actually, it
years
was
or
the
so.
nurses.
Nurses' Health Study.
Yeah.
Okay. And what they did is they looked at 60,000 people, okay, who were in the study, and they found that they were the people who were in it that used aspartame in, say, a couple of drinks a day were about 30% more likely to have a cardiovascular event, and if they did, they were 50% more likely to die from it.
And the other thing about it is that it sneaked into a lot of foods. Many times people don't even know it's in there.
Exactly. So we have a system that's not serving us well. It's really looking at the kinds of things that make money. And if you expect to get sick, because that's how the medical paradigm is, then you're going to fit right into the system. It's very high tech. And while we wouldn't want to throw away this high tech approach that we have because it's marvelous in some settings, we also have to look at the low-tech stuff. And that's the lifestyle, the diet, exercise, stress reduction, sleep, weight, exposure to toxic chemicals, and finding joy in life. That's what keeps us healthy. That's a good preventive model. And that thinking would save us about 80% of our healthcare costs.
Yeah, that's what I was going to ask you.
Yeah. And so big business isn't going to like that. That's a conflict of interest for business, but it's not a conflict of interest for quality of life and for happiness and feeling good. And that's what we should be really focusing on the most. It's not about how much money you have and how many cars and boats and things that you own. It's about how well are you living your life? What are you getting out of it?
And also, can we even really trust the research?
Well, not the stuff that comes when there's a conflict of interest. And anytime you've got the pharmaceutical industry publishing papers, you've got to really scrutinize them because they actually they spend $92 billion a year on research, and the National Institutes of Health spends only $32 billion. So we're getting a lot of research from a resource that has a conflict of interest, and they don't publish the negative things, if they can possibly help it, that come out from their studies that show that they spent $500 million to bring a drug to market and find out it doesn't work. They don't say, don't buy our drug because it stinks. They're going to find a way to try and salvage it the best they can, and they put a lot of time and effort into that.
Well, the other thing, too, is that I think that doctors are mostly nowadays trained by the pharmaceutical companies.
Absolutely.
And so this is one of the reasons that they don't emphasize living a healthy lifestyle. They're emphasizing the medications.
Well,
the pharmaceutical companies are, providing doctors with a lot of their educational units.
That's right. There's CMEs that they have to do 25
and they
hours
give them
every
gifts
year.
and dinners and free samples, and then the
Exactly.
doctors give those to you too. And
Exactly.
it's
So it's a system.
circle.
I mean, the pharmaceutical companies would go broke if we were well. And so they have a stake in keeping people sick. And I'm not saying that there's an overt attempt to do that, but I can tell you a story that'll make you really think twice. Remember Vioxx, that drug that was out in 1999? It was like Celebrex and Bextra and the other non-steroidal anti-inflammatory drugs, of which aspirin and Aleve Motrin are part of. Well, in 1994, the drug company knew that that Vioxx caused heart attacks and strokes. They withheld that information, didn't tell the FDA in the year 1999 when the drug came out, and 5 years later, doctors are going, what's going on? There are a lot of heart attacks and strokes here, and they figured it out that it was Vioxx. Well, when the Freedom of Information Act revealed from their internal records that they knew about this in 1995, it's telling you something about the ethics and the morality that doesn't exist in that setting because they thought they could get away with a business deal. And what was that business deal? Well, it'll cost us about $5 billion, which is a heck of a lot of money, but we're going to make about 20. And that's going to make us a profit still. And 50,000 people died because of that, and hundreds of thousands had heart attacks and strokes.
They should have been sued for murder.
Well, they should have gone to jail for it, for sure.
Yeah.
But that's giving you some kind of idea of what happens some of the time in situations where sickness is depended upon by the people who are in the medical industry. It's
And then
not
a
a
lot
good
of
scenario.
and then a lot of the drugs are fast tracked in, and they're used. They call it off-label use.
Right, and they promote it even though it's illegal to do because, again, the drug reps come to the doctors and they buddy them because they play golf with them or tennis or take them on a trip or give them something that they want, and then they're beholden to them. So we've got to clean up our act. We need to move from a disease care model to a health care model. We the people cannot afford to be as sick as we are. It's not about money. It's about how well we live our lives, how healthy we are, and how much we're enjoying our good health so that we can do the things that we want to do without being sick.